Hello, everyone. Welcome to Future Minority Dentists Club on Clubhouse. My name is Paula Benefo. I am a rising D1 at the University of California, San Francisco. And today's topic is dental terminology in Spanish. This is a discussion that's really close to my heart because I created it knowing that being a multilingual, undocumented person myself, I know that it's really important for dentists and dental students to communicate with their patients that they see during clinic and once they graduate. And so I wanted to start this series of dental terminology in X language. And today's topic is obviously focusing on Spanish. I have Josie here with me, and she is going to be our moderator for tonight, and also just really help us understand what we need to know and understand. And I hope that we can towards the end perhaps be able to practice, but this is her event and this is her discussion, so I really look forward to how what we can learn today. So I'm just going to pass the mic to Josie, and this is Paula, and I'm done speaking.
Hi, Paula. Thank you so much for having me on. I am so excited that you invited me to do something like this because I think, like you mentioned, it is extremely important. Patient-centered care is something that doesn't only start with, what we provide, but also huge with communication. And as an Afro-Latina, it really is near and dear to my heart that our patients get the most care, but that also requires us to be very, very conscious of the fact that sometimes, they might understand English, right? But they might not be able to express themselves and everything that they're feeling in English with you. So obviously, you guys, I can't teach you how to speak Spanish in 30 minutes or an hour, but I can give you some keywords that you can look out for, or we can also try to make it more interactive, and you guys can raise your hand and come up here to practice certain words. It's like a non-judgment zone. Just a little bit about me. I was actually born in Cuba, and if you guys wanted to check out more Spanish terminology, I did a Spanish series on my Instagram, and that was really popular, and you can always refer back to that. But anyway, we'll get started. So you don't have to say complete sentences. Honestly, your patients, if you just try to say one thing in your broken Spanish, they will truly, truly appreciate it. So building patient rapport is important. Making sure that we understand emergency care, also trying to pinpoint down your patient's chief complaint, and then lastly, closing out the appointment, making sure it's positive, making sure that their needs were addressed. So at any time, seriously, if you have any questions about how to say something, or you want to learn how to say something in specific that you've had a burning question about, just raise your hand, let me know. Hi, Kamisha. But yeah, hi, Alicia, Valentina, Adriana, Apurva, and Big. So good morning, good afternoon, how are you? Really important, right? So hola is how are you? ¿Cómo estás? Apurva, hi.
Hi there.
Would you like to know something in specific when it comes to patient rapport? If so, just let me know. So yeah, if you want to say hello, just go ahead and say hola, ¿cómo estás? ¿Cómo estás? And that just simply means hello, how are you? I don't know how it works in other schools. I think we're all dental students in this room. But if you are started in your appointment by somebody that's interpreting for you, and then you're just left with your patient by yourself throughout the appointment, that's totally different. But you still at least want to introduce yourself. So, hola, ¿cómo estás? If you want to say my name is, you would say mi nombre es. So I don't know if anybody wants to try doing or saying one of those things with me. Apurva, since you're here, or Adriana, or Kavisha, if any of you guys want to try introducing yourselves in Spanish, I'm happy to help you out.
I can try. I kind of speak Spanish, but I can still try.
Yeah, let's do it. So I'm your patient. Go ahead and introduce yourself to me.
Hola, ¿cómo están? Me llamo Camisha Sherry.
Perfect. Hola, Camisha. So Camisha did a great job introducing herself. So she just said, "Hi, how are you? My name is Camisha. Hola, ¿cómo estás? And mi nombre es." So that's really important. Does anybody else want to try it, or should we move on?
Okay, so I guess for you, can you clarify if nombre or me llama is interchangeable for Spanish speakers? Is that more standardized across the board?
Yeah, I was gonna ask the same thing.
Yeah, so you can say mi nombre es, so my name, that literally translates to my name is. Me llamo, it also means like, it translates to I'm called, but it's the same thing as saying my name is. So you can say mi nombre es Josie or me llamo Josie. Both ways are correct. Yeah, that's a really good question.
Apurva or Adriana, do you guys want to try? I'm hoping that this is more collaborative versus just listening in, so we're not just speaking into a void.
Yeah, I can try.
Yes.
Hola, ¿cómo estás? Now, is it hombres or?
Mi nombre?
Mi nombre es Apurva.
Perfect! That was awesome. Really good job. Anybody else want to try before we learn something?
I'll go ahead and try. I mean, I'm Spanish, but I broken Spanish, like, not the proper terminology. So I was like, oh, join and, better my Spanish. Even as a Spanish speaker, like, I can always get better still. So, hola, ¿cómo estás? Mi nombre es Adriana.
Perfect. And so, that's actually very common. Like, even sometimes as Spanish speakers, especially once we get into more of the dental terms, you don't hear those often. So it's really good to practice as well. Anyone else? Okay, so we'll move on. One thing to kind of close... Oh, go ahead. Okay, so Boga, if you'd like to practice, just let us know. But one way to kind of close out that rapport... Oh, go ahead, Boga. So one way to close out that rapport if you're just meeting your patient is you can say mucho gusto. It's pretty much like saying nice to meet you. So mucho gusto.
What? Mucho what?
Mucho gusto.
What does that mean?
That means like nice to meet you. So let's say you've introduced yourself. You said, hi, my name is so-and-so. And then your patient's going to say, oh, nice to meet you. And then you can say mucho gusto. Does anybody else want to try that? Yeah, go ahead.
Mucho gusto.
Perfect. Anyone else want to try saying mucho gusto?
Mucho gusto.
Nice. Okay, so that's a nice way. That's typically how it will go. You introduce yourself, you ask them how they're doing, you tell them your name, and then they will say nice to meet you, and you'll say mucho gusto. So another thing that you guys will want to key in on is chief complaint. And a lot of times one of the main things that we ask is, are you in pain, right? So the word for pain is dolor. Dolor is the word for pain. So you can ask, ¿Usted tiene dolor? Do you have any pain? So, ¿Usted tiene dolor? Does anybody else want to try saying just the word dolor? Or you can try going for ¿Usted tiene dolor?
Could you also perhaps spell out so we could come back with notes with this, how to spell some of these?
Yeah. So dolor is D as in dog, O-L-O-R. Dolor.
Okay, I want to ask you something.
Yes.
What's the meaning of me alegro mucho de conocerlo?
It's pretty much similar to nice to meet you, but you're basically saying like, I'm very happy to meet you.
Okay, thanks.
Yeah, my pleasure.
Okay, I can, so, ¿Usted tiene dolor?
Perfect. Anyone else want to try asking your patient if they're in pain?
I think I have a Spanish accent.
You definitely do. I definitely heard a little bit there.
Buenos dias, I think. Yeah, buenos dias. It's
Buenos
good
dias.
morning.
Yeah.
Yeah, then another one is buenos tardes, I think.
Buenas tardes would be good afternoon. Yeah, that's right.
Yeah, the last one is buenos noches, I think.
Yes, and hopefully you're not seeing your patient at night. So, do you want to try, Boga, saying usted tiene dolor or dolor?
Dolor, that's mean pain, yeah?
Yes. So that's a really important word, you guys. And if you can take anything away from this, have it be that.
How can I say root canal treatment in Spanish?
Yeah, so that's a little different, and we'll get to more treatment care. So for that one, it's like it depends on where they're from. So a lot of times, literally, like you can just say root canal and they'll understand that, because in Spanish, endodoncia is endodontics. So a lot of your patients won't actually know that that's what that is. So a lot of them actually understand root canal, especially in this country. Yeah.
I got it, thanks.
Yeah, of course. Another word that you want to obviously know is alergia. So alergia is an allergy. So we're gonna go ahead and do basically for a comp exam. So alergia. Does anybody want to try saying that? It's pretty much like allergy.
Alegría.
Alergia.
Alergia.
Anyone else?
Algeria.
So this one, I know this one sounds a little tricky. So alergia. So this one, it starts with an A-L. Alergia.
Alergia.
Alergia. Perfect.
Alergia.
Yeah, Boga, you're really good.
Yeah, so alergia, just like allergy. So you definitely want to ask them if they have any allergies. And then if you want to ask them about their medications, it sounds very similar. So medicamento. Medicamento.
Medicamento.
Yes, is medication. Does anyone else want to try saying medicamento?
Medicamento.
Perfect.
Medicamento.
Medicamento, yes.
How can we put it in a sentence, like ask, or like the proper sentence to ask them if they're taking any medication?
¿Qué medicamento está tomando? So we always want to ask open-ended questions, because your patients will either say yes or no, and then you're not getting anything. So if you ask them, ¿qué medicamento está tomando? ¿Qué is what? Medicamento is medication, and tomando is taking. And then your patient will tell you, or they'll say, no, I'm not taking anything. So, ¿qué medicamento está tomando? Does anyone want to try saying that one? I know that one's a little longer. Adriana, you want to try it?
And then if you guys need me to spell any of these, I can for you guys. For example, this one is QUE space medicamento is MEDICA MENTO. Está is ESTA, and tomando is TOMANDO. Question mark.
So I think, Adriana, you wanted to try something more proper. So if you want to go ahead and do it first. ¿Qué medicamento está tomando?
¿Qué medicamento está tomando?
Perfect. Good job. Anyone else want to try that one? It's a little longer.
¿Qué medicamento?
Oh, okay. Kamisha, you want to go first, and then Boga?
Sorry, Boga. ¿Qué medicamento?
Oh, I
¿Qué
think
medicamento?
And then don't forget, está tomando.
What?
And don't forget to finish it with está tomando. So, ¿qué medicamento está tomando?
No, the second part is so difficult.
You can do it. I know you can do it. Hopefully this is being recorded, so you'll be able to refer back. But yeah, ¿qué medicamento está tomando? Really important. One more thing, I guess, before we move on to actual like findings. Blood pressure. So, and especially in schools, we always have to take, their BP. So, presión. So, la presión is how they will understand it. So, voy a tomarle la presión o voy a medirle la presión. They'll understand both. So, presión is blood pressure. Presion. Presión. La presión. Blood pressure. Does anybody want to try just saying the word? Presión. Good job, Adriana. Kamisha, you want to try?
That was me.
Oh.
That was me.
Presión.
Presión. Good job, Kamisha. Good job, Adriana.
La presión.
La presión. Great job. Apurva, you want to try?
Yeah, la presión.
Awesome. Yeah, and if anybody else wants to come up here and try, you guys just go ahead and raise your hand and don't be shy. Like, we're all just learning here. So, la presión. Voy a tomarle la presión. Or you can say su presión. But for the purpose of this, let's just say voy a tomarle la presión. Okay? Who wants to try that? The longer phrase.
What's the first part of it? Boy. What
Voy.
does it mean?
Voy is I'm going to. So voy is V as in Victor, O-Y.
Voy a tomarle la presión.
Perfect. Apurva, do you want to
tomar la presión.
Great job, Boga.
Yeah, I want to try. Voy a tomarle la presión.
Good job. Yeah. So, okay. So we've introduced ourselves to our patient. We've taken their blood pressure. We now know if they have any allergies or.
One more thing.
Yeah.
Sorry.
No.
Can we show everyone how to ask, because we do have female patients, the pregnancy question?
Okay. So if you want to ask them if they're pregnant, you can say, so being pregnant is está embarazada. So embarazada, it almost sounds like embarrassment in English. But in Spanish, embarazada means pregnant. So you can say, ¿usted está embarazada? Question mark. So,
¿Está usted embarazada?
¿usted está embarazada? Kamisha, do you want to try that one?
Yes, ma'am. Just to let y'all know, I have a lisp, so ever since I was little, I can't say my R's, okay? My sisters used to laugh at me. Anyways, usted está embarazada.
That sounded amazing, so I don't know what you're
Yeah,
talking
okay.
about.
No, I have a really bad lisp, y'all. Y'all don't want to hear me speak Spanish because I sound like crazy.
I thought that sounded actually really great. So, ¿usted está embarazada? That's a really good question, and you can ask your patient. If you wanted to ask them if they're taking birth control, because that's actually a question that we ask in our personal form, it's pastillas anticonceptivas. Pastillas anticonceptivas. It's a little harder. So, who wants to try that? Pastillas anticonceptivas.
Pastillas anticonceptivas.
Very close, yeah. So it's with an A. Anticonceptivas.
Anticonceptivas.
Perfect. Good job.
Pastilla anticonceptiva?
Yes. You got it.
Never heard that word before.
Yeah, so that's birth control pill, and it's important to ask because sometimes, certain antibiotics So we have to let the patient know. Anyone else want to try pastillas anticonceptivas?
Pastillas anticonceptivas.
Great job! That's awesome. You guys are actually pretty good at Spanish, so you don't even need me. So that's
What do we say for breastfeeding? Are you breastfeeding?
so you can, if you want to just keep it simple, you can say está, like, so milk is leche. Leche is milk. So you can just keep it simple and say le está dando leche al niño o niña, you know. You, or maybe if you want to keep it gender neutral, you can say baby, you know. So leche is milk. If you forget everything, just say le está dando pecho al niño. Pecho is breast. So a lot of times they'll recognize it like that. Le está dando el pecho al niño. Pecho.
Got it. Thank you.
What was
Yeah.
the first part?
Le está dando pecho al niño. Also, when you guys actually discuss this, if you discuss this with somebody who is speaking and actually understands like medical terminology, lactancia is like lactating, you know. But usually your patients will understand le está dando el pecho al niño, and they'll tell you yes or no. And then formula is literally the same thing. Formula, and formula in Spanish, formula in English. So now that you guys kind of have a breakdown of that, very big thing, head and neck exams. So does anyone know how to say neck?
Is that pescuezo?
So we want to say
Cuello.
neck. Okay, so it's very close. It's cuello. So neck is cuello. Anyone else want to try that?
Cuello. So double L. Ella.
Yes, exactly. Double L. So you had it. Yeah, cuello.
Cuello.
That's perfect. So yeah, so neck is cuello. And a lot of times because you're going to go in and do a soft tissue exam, so important to mention cuello. What else would you guys like to know when it comes to medical history wise? If not, then we'll move on to findings. Okay, so we'll move on to findings.
I was trying to unmute myself.
Oh, okay.
When would we use, or how would we use neck in a sentence to let them know that we are doing a head and neck examination?
Yeah, so you can say, voy a revisar. So you can combine head and neck. So neck is cuello, and then head is cabeza. So cabeza, head, neck, cuello. So you can say, ahora vamos a examinar su cabeza y su cuello. So ahora vamos a examinar su cabeza y su cuello. And a lot of times, you know, it's a very personal thing. So you can say, voy a tocar su cabeza y su cuello. Also letting them know that you're about to touch them, okay? So you can let them know that you're about to examine them, or if you really want to be like very detailed, you can say that you're about to touch their head and neck. Does anybody want to try that? Voy a examinar su cabeza y su cuello.
Voy a examinar su cabeza y su cuello.
Perfect. Yeah, so very important to just let them know. Anything else? Any other questions?
What about x-rays? Would you do x-rays before a neck and head examination?
That depends on your workflow. Really, I guess it depends on your appointment. But X-rays are radiografías. Radiografías. Radiografías.
Radiografías.
Perfect. And a lot of the times, oh, go ahead, Adriana.
Oh, I was just gonna say radiografías.
Good job. It sounds great. You guys are awesome. And a lot of times, sometimes patients know it as radios X. So that you might also hear them say that. Oh, hi, Alicia. Did you want to say something or try something? No? Okay, so also, it's also important. Oh, go ahead.
Oh, I wanted to ask, how do you ask them if they have sugar or diabetes?
Yeah, you can say, for diabetes, it's diabetes. Diabetes.
Diabetes?
Yes, diabetes. Yeah, my pleasure. And then if they say, yes, I am diabetic, you can ask them what their, sugar level is. So you can say, ¿cuál es su nivel de azúcar? O sabe is, do you know? ¿Sabe su nivel de azúcar? Nivel is level. De azúcar is sugar. ¿Sabe su nivel de azúcar? So that's always important. And if you just know the word azúcar and nivel, they will probably understand you.
Can you repeat the sentence one more time about asking them if they know their sugar level?
Yeah. ¿Sabe su nivel de azúcar? So really, really important. That's a great question, Alicia. Anyone else? Okay. So something really important that we'll have to deal with forever is knowing how to say tongue. So lengua. Lengua is tongue. Lengua. Anyone want to try?
Lengua.
Lengua.
Lengua. Yeah. Lengua is tongue, and you're going to be fighting with that forever, so very important to know. Also very important when we want to ask them to smile. So a lot of times we want to check their, smile line, removable, anything like that. You can say sonría. Sonría, por favor. Adding por favor after anything just makes everything more respectful. So por favor is please. Por favor, please. So sonría, por favor. That means smile, please. Anyone want to try? Sonría, por favor.
Sonría, por favor.
Awesome. Yeah, so now your patient knows that you want them to smile and you can evaluate them. Also, just to mention, inflammation. Inflammation is an important word, right? We would discuss it with perio, anything like that. It's inflamación. Inflamación. Inflammation. Does someone want to try that? Inflamación.
Inflamación.
Yes. Inflamación. So, yeah, go ahead, Apurva.
Inflamación.
Yes. So yeah, just like inflammation, but it sounds a little softer. Inflamación.
What about, how do we say, can you please open your mouth?
Yeah, that's a great question. So, mouth is boca. Boca is mouth. So if you want them to open their mouth, you can say, abra la boca, por favor. Abra la boca, por favor. Abra is open. La boca is mouth. So, abra la boca, por favor. Who wants to try that?
Abra la boca, por favor.
Yes, Alicia, very good. Apurva, do you want to try?
Yeah, I can give it a try. Abra la boca, por favor. Por favor.
Yeah, por favor. Favor.
Okay, got it. Thank you.
Awesome. No, you did great. And that's an awesome question because, yeah, we constantly ask them to open their mouths. So,
What about when we have to ask them like to move their tongue to the left, right, or up?
yeah, so right is derecha. Derecha is right. And left is izquierda. So let's try saying right and left first before going into the sentence. So, derecha. Let's go around and try saying derecha. We can start with Kamisha. Kamisha, do you want to try saying derecha?
Derecha.
Derecha. Perfect. So that's right.
Derecha.
Nice job.
Derecha.
Yeah, so
Derecha.
yeah, that's exactly it. So derecha is right. And now izquierda is a little harder. Izquierda. Give it a shot.
Izquierda.
Nice.
Izquierda.
Okay, Apurva, we're going to do it one more time. You pretty much had it. Izquierda.
Izquierda.
Nice. That's awesome.
Thank you.
Okay, so izquierda. And then once you want them to actually move is very similar. Mueva. 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 So if you want to say something like we just learned, lengua, which is tongue, mueva su lengua hacia la derecha. So hacia is to the. So mueva is move, su lengua, your tongue, hacia la derecha. And then, of course, you can add please later. Does someone want to try that one?
Mueva su lengua hacia a la derecha, por favor.
Nice. Yeah, that's a little harder. So that's really good. Anyone else have a question regarding, like directional terms?
Oh,
Okay.
what about up or down?
Up or down? Arriba, hacia arriba. Arriba is up. Hacia abajo is down. So abajo is down. Arriba is up. And remember we said hacia is to the. So hacia arriba is up. Hacia abajo is down. Cool. So, one of the biggest things is when we're talking about decay, your patients will understand it as caries. Caries. So, caries, caries. Does anyone want to try caries?
Caries.
Great job, Alicia. Yeah, caries. If we wanted to say something like enamel, right? There could be something affecting their enamel. Esmalte. Esmalte. And if we wanted to try telling them there's something going on at the root of the tooth, you can say raíz. Raíz. So raíz is root. So again, enamel, esmalte, raíz is root, and if you want to say caries, is carie. Cool. Does anyone have any questions for that part? Just kind of like directional and then anatomy / findings. All right.
Could you maybe spell the word for root? Is it fries or rice? Or what, how do
Raíz.
you...
So raíz is R-A-I-Z as in zebra. So raíz.
Thank you.
Yeah, my pleasure. And in Spanish, if we want to, follow up with the caries, bacteria is just as it sounds, bacteria. So bacteria. So they will understand that. When you want to say their gums, so gums, encilla. Who wants to try saying gums? Because that's you're gonna say that all day long, especially during a comp exam. If you're probing or anything like that, checking the health of their gums. Encilla.
Encilla.
Good job. Yeah, encilla. If you want to tell them that they have gingivitis, right? So we're now talking more perio. It's just gingivitis. So it's the same thing. You just, instead of saying gin, you will say gin. So gingivitis. Apurva, do you want to try? Or Adriana? Adriana, I think you wanted to try.
Gingivitis.
Yeah, gingivitis. Awesome.
Gingivitis.
Gingivitis. Yeah, that's really good. If you if you want to mention to them, or if you want to ask them if they floss, hilo dental. Hilo dental. So there's no colloquial term for that, that you really will have to say hilo dental. If you say floss, they won't understand. Pasta dental is toothpaste. So pasta dental, toothpaste. Hilo dental is floss. Anyone want to try any of those?
Is it hilo dental?
Yeah.
Okay. How would we use that in a sentence?
You can ask them how many times a day they're flossing. So you can say, ¿cuántas veces al día se pasa el hilo dental? So ¿cuántas veces? How many times? Al día. Al día is a day. Se pasa, are you using or passing? It's a little bit harder to translate. El hilo dental. Floss. So how many times a day are you flossing? ¿Cuántas veces al día se pasa el hilo dental? Yeah.
Thank you.
Yeah, my pleasure. And then brushing is cepillar. So cepillar is to brush. So yeah, that's all. So that's all perio. We talked about gingivitis. We talked about encilla, hilo dental, pasta dental. And if you want to tell them that they need a cleaning, you can say limpieza. Limpieza. Necesita una limpieza.
How do we say like a bone infection, something like that, like something related to bone?
So bone is hueso. Hueso. So if you want to say, a lot of times, they might have bone loss. So you can say pérdida de hueso. That's bone loss. Pérdida de hueso. If you ever want to say something like infection, infección. Infección is infection. Okay, anyone else want to ask a question when it relates to perio or a disease process or anything like that? Awesome. So let's talk about treatments. So if your patient needs a filling, that's un empaste o un relleno. So they can pretty much understand either or, really just depends on where they're from. So empaste, relleno. Empaste or relleno. Kamisha, Apurva, Alicia, if you guys want to try saying either of those, feel free. Empaste, relleno.
Empaste relleno.
Perfect. So, empaste, you can just say that by itself is filling. Necesita un empaste. Or alternatively, you can say necesita un relleno. Then if you wanted to do amalgam, it's amalgama. 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 A lot of times also, you can tell your patient that they'll say like, oh, what is amalgam? What's the difference between amalgam and the other one? And then you can tell them, well, the empaste relleno, like the composite itself, is tooth-colored filling. So, color de diente. Un empaste color de diente. Diente is tooth. Can't believe we haven't even said that one yet. So, diente is tooth. So, color is color. So, color de diente, tooth colored filling, is color, empaste color de diente. If you want to tell them that they need a crown, it's corona. Corona. Anyone want to try saying corona? Because that one's actually like a pretty important. Corona.
Corona.
Yeah. So, corona, you need a crown. Necesita una corona. Necesita una corona. If you want to say bridge, you want to say puente. Puente. Necesita un puente. Anyone want to try puente?
Puente.
Awesome. Yeah. So if your patient needs a bridge, puente. Necesita un puente. If they need an implant, it's very, very similar. Implante. So just add a t. So implante. So instead of implant, implante. And then for kids, I don't know how many kids you guys see. For our school, we actually have to see kids bi-weekly. So a lot of times we'll do some sealants, and you can call that sellos. Sellos are sealants. Any questions on other treatments? There's a ton of treatments that we can talk about, but any questions that you guys would like to know when it comes to treatments? Hi, Mauricio. I see that you're here.
Hi, thank you so much for having me. How is, sorry, I have a question.
Yeah.
In Spanish language, how is abutment?
Okay, yeah, that's really hard. And I honestly don't think that your patient will want to. Yeah, your patient will want to know that. You know how it is like when you're explaining a treatment, it's always better to like make it as easy for them to understand as possible. So I think sometimes like abutment is like we shy away from it. So you can what you can tell them is diente artificial. So you can say diente artificial. So artificial.
Diente artificial.
Right, and that would describe actually your pontic. So as far as the abutment teeth, you're actually going to explain to them that you're going to shave those down, right? But in the middle, your pontic's going to be an artificial tooth, held on by the other tooth.
Thank you so much. Thank you so much.
My pleasure. So, and that's actually a great question, Mauricio, because when you're doing any kind of removable, you're going to use that word, diente artificial.
Bueno. Diente artificial.
Yes, exactly.
So
Any other treatments? Yeah, go ahead.
So how would we use diente artificial if we're not doing an abutment, or you said there were other ways to kind of explain this?
If you're not doing an abutment, so an abutment, just if you guys are not familiar with what an abutment is, so that would be like a good intro. So you call abutment teeth the teeth that are basically on either side of a pontic. So if you're doing a bridge, let's say the patient is missing tooth number 9, your abutment teeth would be 8 and 10. Those are the teeth that you're going to have to prep in order to put in, the pontic. So the whole artificial teeth deal is basically just explaining to them what's going to go in that space, or if you're doing any kind of removable, they're artificial teeth. So, diente artificial. During your removable appointment, you might ask them, like, we're going to pick out, a color for the teeth. So you can say, un color para los dientes artificiales. That's actually, now I can mention to you how a lot of times patients hear the word denture. It really depends on where they're from. So a denture can either be una dentadura, which also means like your actual mouth, or it can be placa. Placa is the most popular, especially if they're from Mexico. So placa, denture, placa. So a placa, a denture, has artificial teeth, dientes artificiales. That's a good question. Anything else?
Sorry, the root canal.
Oh yeah, so we were talking about this in the beginning. So a lot of times patients, especially if they've been in the US, they actually just know root canal by like root canal, okay? But if you literally just tell them root canal, and they will understand you, because it's more of like, you can say endodoncia. You can say endodoncia is endodontics. So a lot of times, if you just say root canal, they'll ask you what the actual process is. They won't understand like a specific word because it's just a little bit more complicated. Okay.
So could you you said that raíz is root, correct?
Correct.
So it's kind of like, because I know growing up, my mother spoke Spanish, but I would just throw like one word at her or put two words together and she knew what I was saying, So, like canal, raíz.
Yeah, so you can explain to them, for example, you can say, tiene una infección de la raíz. So you have an infection at the root, and then you can tell them that you need to, treat that. And you can say es con un root canal para su infección de su raíz. So infección de la raíz is an infection at the root. Okay. Any other questions relating to treatments? I know when we get into like specialty treatments, it gets a little trickier because it's how to like make it simple enough for them to understand.
How do we say like today's just going to be a regular cleaning?
So hoy vamos a hacer una limpieza. Limpieza is just a regular cleaning. Hoy vamos a hacer una limpieza. Hoy is today. If you wanted to say a deep cleaning, right? So an SRP, you can say limpieza profunda. That literally translates into deep cleaning. So limpieza profunda. Hoy vamos a hacer una limpieza profunda is deep cleaning. And then if you just wanted to do a propane, Hoy vamos a hacer una limpieza and you don't add the profunda. Does that answer your question?
Yes.
Okay, awesome. Any other treatments you guys are curious about?
How do you tell them to bite down?
Yeah, that's an awesome question. So, muerda is to bite. Muerda, por favor. So we wouldn't tell them, in English we actually tell people like bite down. But in Spanish, if you just say muerda, por favor, they know it's an action and they will bite. So muerda, por favor. Did you want to try it?
Muerda, por favor.
Awesome, yeah, muerda, por favor.
Muerda, por favor.
Perfect, Mauricio. Yes, you guys are killing it.
Oh. And sorry, one question.
Yeah.
And the deep bite and deep bite is when the bite is very deep.
Like so a deep bite, una mordida so
Bueno.
yeah, so mordida profunda wouldn't it's almost like you would say this with your patient, but you almost would have very limited times where you would actually say this to them, right? Maybe if you're doing like a lot of ortho, when you do a functional evaluation for your patient, when you're examining like their bite, all of that, then you can say pretty much to them, if you really, really, really wanted them to know that they have a deep bite, you can say you have like una mordida profunda.
Bueno.
But I don't see you using it, to be honest. You're probably just going to use that for your own information.
Okay. Thank you.
Yeah. Anything? Oh, by the way, if you guys wanted to know braces, frenos. Braces, frenos. So a lot of times your patients will say, me quiero poner los frenos. I want to get braces. Me quiero poner los frenos. I want to get braces. So you'll hear them say that. Anything else when it comes to treatments?
So I know we tell our patients, I'm a dental assistant, I'm not in dental school yet, but we tell our patients to relax a lot. How would you tell your patient to relax in Spanish?
So depends, right? So if you want themselves to relax, you can say, no se preocupe, relájese. So like, don't worry, relax. So no se preocupe, don't worry. No se preocupe, don't worry. And relax is relájese. Relájese. These that. Do you want to try it, Kamisha? I think your R's are fine. You're totally fine.
No, ma'am, I got will not do it.
So relájese is relax. If you want to say relax your mouth, because sometimes they get really tense, or if you're trying to get them into CR, centric relation, you can say relaje su boca. Relaje su boca. Relax your mouth. Relax your mouth. As you're like frantically sweating trying to get them into CR. It's kind of like a funky position to get a patient into for those of you that are still, learning. But yeah, relax your mouth. Relaje su boca. And always, like I said, add por favor to everything, please. And it just makes everything so much more respectful. Yeah, so one last thing that I'll say, if we don't have any more like treatment questions, something that we didn't talk about was anesthetic. So obviously we have to anesthetize at some point. So if we say lo voy a anestesiar or la voy a anestesiar, anestesiar is to anesthetize. So la voy a anestesiar, or you can say I'm going to give you anesthesia, le voy a dar anestesia, or le voy a poner anestesia. Honestly, if you say anesthesia, like they'll understand it's coming. So anesthesia. Does somebody want to try that? Anesthesia. Nice. Anyone?
Anesthesia.
Nice job, Mauricio. You guys, Kamisha, Mauricio, you guys are killing that. Anesthesia. Alicia, Purva, did you guys want to try anesthesia if you want?
Anesthesia.
Nice. Alicia?
Anesthesia.
Oh my god, you guys are such a good group. You did great. Honestly, it's been a long day, but it's been so fun to see you guys try all of these words out. And I know sometimes it's not hard to just like throw yourself out there with a different language. So you guys are, you made my afternoon, really.
And the one when you must talk about please open your mouth, I must make the put the anesthetic inside. How you explain this?
So you can say, so previously we said open your mouth would be abra la boca, por favor. You can now. Oh, go ahead.
Abra la boca, por favor.
Yeah. So you can say abra la boca, por favor. Vamos a anestesiar. So, and the reason why I'm saying this is there's a million ways to say this part, but maybe the easiest way for you guys to remember is to say like vamos a anestesiar, or you can say the proper way to say it is voy a anestesiarla or voy a anestesiarlo. Just to tell them, depending if it's a woman or a man, that you're going to anesthetize them. Or you can say, abra la boca, por favor, voy a darle anestesia. Voy a darle anestesia.
Voy a darle anestesia. Okay,
yes.
Okay, thank you.
Perfect. Yeah. So those are pretty much all of the main points. I mean, that should give you guys the best possible way to address your patients and also explain to them, some disease processes, some treatments, and just figure out a little bit more about their medical history. So I hope that was helpful, and thank you so much for actually trying.
I have one more question. What about when you want to ask your patient to rinse after like getting a cleaning? You give them something to put water in and then to rinse or spit out.
Yeah, so if you want them to rinse or spit out, that's funny because I don't think we ever we do it a ton because of the saliva ejector. But you can say, a lot of times if you want to tell them like, cierre la boca, por favor, close your mouth, please. So we talked about abre la boca. So if they're closing their mouth over the saliva ejector, you can say cierre la boca, por favor, and then they'll close their lips on it. That's really important. But if you want them to like rinse, a lot of times they will say buche. It really depends on where they're from. So, puede darse un buche, por favor. What else can you say? You can say enjuáguese la boca, por favor. Enjuáguese la boca. So enjuagar is literally rinse. So enjuáguese la boca, por favor. Y it's like in Spanish, to spit is like a kind of a strong word. So you can say escupir. Puede escupir aquí. Escupir is to spit, escupir, and you can tell them in a cup. cup like en este vaso. So you can say like cup or glass or whatever that you're using. So vaso. Puedes escupir en este vaso. So enjuáguese la boca con whatever it is that you gave them to rinse their mouth with. And then puede escupir acá o puede escupir en este vaso.
Okay, I think that's all for me. If you have any questions, anyone in the audience, just please raise your hand and I can bring you up to the platform to ask Josie any more questions. Otherwise, then we'll just close out the room. But right now, I'm just going to give you guys a chance to interact with her while she's here with us.
Yeah, you guys were honestly awesome. And then if you ever want to reach out or you have a question about how to say something, you can literally send me a DM at Josie Dental on Insta. I typically, have the time, and in between clinic and patients, I'll probably send you a voice message and help you out.
Okay. It doesn't seem like anyone...
Thank you so much.
Thank you so much. Thank you.
Gracias.
De nada. Un placer.
Bueno.
Okay. Well, I hope I can invite Josie, hopefully closer to when fall starts, for rising D1s who are starting clinic. So I will definitely reach out to you again, Josie. Thank you so much for joining us this month.
Absolutely. Thank you so much for having me. This is awesome that you guys are doing this. I hope I can tune in for a language I'm not familiar with and learn.
For sure. It's coming soon. Well, I'm just going to end this room, and hopefully you guys can press the greenhouse in the upper right hand corner to follow and join our club on Clubhouse, and we will have our events listed soon. Hope to see you guys soon. Thank you.